Good morning, or good afternoon, or good evening, depending on when you're going to be watching this. This is the voice and face of Dr. Tolulope Olabintan, CEO and founder of Livingspring Family Medical Center, a hub where we help our patients live long and well here in the city of Mansfield, Texas. I'm so excited to be here. I know it wasn't that long I was here, but I'm excited to be here to talk prostate health. This was a popular request, and so we're here doing this. And typically before I start, I always like to kind of, talk about why we're doing this. And we're doing this because I've had quite a few patients talk about, well, the prostate, prostate health, of course, we know these are our men patients. And so I thought, hey, why not? Let's get Dr. Kelley, who's a urologist here in Texas, the Mansfield area, actually, as well as surrounding cities. And he agreed. So I'm so excited to be talking about this. All right.
Hello.
Hi. How are you?
I'm doing great. How are you?
Oh, I am good. Awesome. Perfect timing, by the way. I had literally talked about you and said you should be here soon.
Awesome.
So thank you so much for agreeing to do this. All right, so let's get to it.
Sure.
So for the sake of those who may not know you, I did introduce you before you jumped on, but I would love for you to, reintroduce yourself and just answer the question of who are you and what do you do?
Sure. Yeah. So my name's James Kelley, or Jimmy Kelley is what I go by. I am a urologist, a general urologist and urologic surgeon. Live here in Mansfield, Texas, but kind of practice around the entire surrounding area with my main office here based in Mansfield. And I also see patients down over in Burleson and closer to Fort Worth too. So kind of encompassing that whole area. As far as kind of what I do, urology is a, believe it or not, pretty surprisingly wide variety of a field, encompassing literally anything that goes down from the kidneys, the tubes that drain the kidneys, the bladder, anything related to the urinary system, as well as all kind of male reproductive system. So that includes things like kidney stones, urinary tract infections, erectile dysfunction for men, incontinence for females, and then kind of like we're talking about here today, prostate issues or any of the different types of malignancies like prostate cancer, kidney cancer, bladder cancer. Those are all involved. So the urologist is kind of the surgeon and the medical management for all of those areas. And so that's kind of what my main specialty is.
All right, awesome. Thank you for sharing. Now that segues into our next question. Why did you, I'm just curious,
Sure.
And I'm sure, why do you do what you do? Why urology?
Yeah, I feel like that's always one of the first questions that pops up. Someone says, urology,
Yeah.
really? So believe it or not, I had no initial intention of going into urology, really didn't even know about it as a specialty going into medical school. It kind of just fell in my lap. I had been talking with someone about how I really enjoyed the idea of when it came to primary care, getting to follow your patients and stay with them and see them for years and years and years. But I also really enjoyed working with my hands and getting to do kind of a procedural heavy specialty. And when you actually look into urology, that's exactly what it is. A guy with an enlarged prostate or prostate cancer, I'm following him for the rest of his life. We get to build that relationship. He gets to know me as quote unquote his doctor. But on the same note, I'm getting to kind of help people with really vulnerable issues and help them work through it, like leaking or these urinary symptoms with an enlarged prostate, all the way up to things that are even more scary or worrisome, like kidney cancers, bladder cancers, prostate cancers. And so it just ended up being kind of the perfect fit for me, getting to work with patients in those situations and getting to kind of doing urology so far, for sure.
Dr. Kelley. All right, awesome. And I like something you said that was very important. You said you get to deal with patients in a very, sensitive, vulnerable state, and that's big. That's major. Even in conversations with patients, I have to draw out those conversations, like, hey, use to sex, use the bathroom. Even though they say no problem, I re-ask, are you sure? And like, it's open about it. So that's awesome.
Yeah.
Now, so we are here to be educated. Our viewers are eager to learn. And some may be wondering, Doc, what is a prostate?
Sure. Yeah. So first off, the prostate is only in men. It's a male organ, and it serves mostly just a sexual function. So it's a small gland. It sits right underneath the prostate, and it provides some different secretions or fluid that are involved with semen or the material that comes out with ejaculate to kind of help activate the sperm. Other than that purpose, I feel like all it does is get bigger, cause trouble, and get cancer. So all that to say is it does serve a purpose, believe it or not. However, it does cause a lot of issues, which is obviously kind of why we're here today.
Awesome. So the prostate is right under the bladder, and it functions.
Yeah. The way I try to describe it to most of my patients when I'm trying to say, well, what exactly is this thing? If you can imagine your bladder, and underneath your bladder you have a donut, and that donut, as we get older as men, that donut can get a little bit larger and a little bit larger. But what we care about is that donut hole, the hole in the inside, because as that donut gets bigger, that donut hole can get a little bit more narrow, and that's the that your urine is flowing through. So you can imagine kind of that kink on the water hose starting to cause trouble over time for sure.
Right. Thank you for explaining that. That's actually a very good analogy, the donut.
Oh, the donut, this way to explain it. And it's actually a similar shape too. So.
Yeah, true. All right. So when should your prostate be checked? And of course, we know that question is not specific to anyone who's watching. You know, this is something that you need to have in discussion with your own doctor. These are suggestions, so I wanted to highlight that. But when do you suggest that prostate should be checked?
Absolutely. So the prostate, I typically see two main issues when it comes to prostate issues and prostate health. One of the main ones being BPH, or benign prostatic hyperplasia. That's when the prostate gets enlarged, can cause a lot of bothersome urinary tract symptoms. The other side of that is prostate cancer. And those are both kind of two main issues that we go along with. When it comes to when we should have it checked, in regards to screening for prostate cancer, kind of our guidelines, society recommendations say for gentlemen that have no risk factors, no symptoms, any urinary symptoms at all, anywhere from age 55 to 70 is when we kind of do typical screening. And that involves a prostate exam, which is a rectal exam where you feel kind of the back portion of the prostate there. And then a PSA test, which stands for prostate specific antigen. It's just a blood test that we draw, and it's used kind of as a screening test, almost like a prostate cancer screening tool that we use. On the same note, people that have risk factors, meaning maybe your dad or your grandfather had prostate cancer, or your brother, or people that are smokers, or people that are having more bothersome urinary symptoms at a younger age, or African-American race. Those are all risk factors for earlier onset of prostate cancer. And so those are people that I would probably encourage to screen sooner or do prostate checks sooner, maybe around 45 to 50. And again, it's just like you mentioned, it's a conversation that you have either with your primary doctor, or if you are having those symptoms and you're seeing me, those are things that we would talk about as well.
Awesome. So just to highlight a few points that you mentioned, when should someone check? Generally suggested between 50 to 75. You know, and then in patients who may be having symptoms, so urinary tract infection symptoms, or your urine stream, or how strong your flow is, how you have to urinate, how bothersome it is. Exactly. Maybe indications to actually be tested sooner than. All right. So our next question is this: how you kind of alluded to it, but sometimes, like when patients come to the office and it's time to do it, they're shocked. Like, wait a second.
That's an exit only, doc. No,
so how I think it's good to kind of give a heads up. But how is it checked so that our patients are not too shocked?
Right, so you're not thrown off when you walk through the door, for sure. So a prostate exam, it is it's called, the other word for it is a digital rectal exam, meaning one finger goes there into the bottom. The prostate actually, believe it or not, lives just right in front of the rectum. And so one of the most common places for prostate cancer to pop up, if you were going to be able to feel it, is along that back side of the prostate. So you can imagine, if I was going to be able to feel a further along prostate cancer, it sits just right in front of the rectum. So a small finger there in the rectum, right along the prostate area. And that allows me to get both an idea of the size, but also to feel for any lumps or bumps or kind of different tissue texture that allows me to kind of decide whether or not it's concerning at all. But that's typically how it goes. It takes about 5 to 10 seconds, and that's about it.
Okay, and usually a lubricant is used, so it's not painful.
Absolutely, lubricants used. I always coach my patients through to say to make sure that you're in the most kind of comfortable position, meaning knees kind of bent up towards the chest, either laying on your side or elbows down on the table, and it makes it kind of, there's no perfect comfortable way to do it, but it makes it the most or the least uncomfortable. And absolutely, it's typically not a painful exam. And again, it's about a 5 to 10 second, get an idea of what the prostate size, shape, and texture is like too.
Okay, and remember, these are, for those watching, I don't want to, it sounds scary, it's a prevention, right? It's something done to catch things before they become more of an issue down the line, okay? And that's very important. Generally speaking, these are done, once a year? You know, as far you have symptoms, they may be done more frequently, but I want to encourage our viewers who are watching that's something that should be done, especially if you have risk factors like you had mentioned earlier with the smoking, you know, being of the African American race, that's a risk factor too. And then family history. So family members who have had prostate cancer, it's really important to check screen to make sure that you're not at risk.
Exactly. Yep.
All right. Awesome. Now, is there a way to prep for the DRE?
Right. There's nothing that I necessarily need my patients to do. I feel like there's a little bit of the, you know, the self-conscious aspect of it where guys are like, well, you know, I'm not necessarily cleaned up down there. That's not anything you have to worry about. You don't have to do any kind of enema beforehand. You don't have to do anything like that. Again, the exam isn't like a colonoscopy, meaning It's not going all the way up into your intestines, and it's not anything to that extent. It's literally just right there to that area. So not a lot necessarily that you would need to do to prep for it, other than more kind of the mental prep to understand, okay, I know that that's what he's going to be doing, or he or she is going to be doing to feel, and knowing that this is, again, we're trying to catch something ahead of time to prevent missing some kind of prostate cancer or something that could be a bigger issue down the line. Oh.
Okay. I think the mental prep is big. So one of the things I like to do is give a heads up to my patients.
There's
like,
motion activated light in here. Sorry.
You're good. Special effects. It was
right.
Good. It was good. But one of the things, I like to, give the heads up is next visit where we'll be doing the rectal exam, we'll be doing the prostate exam. Nothing to prepare. I just want you to be aware before we, I agree with you. That's generally it. Now, we're talking from a preventive standpoint. Now, how can one preserve or protect one's prostate? Like what can be done proactively to preserve your prostate?
Yeah. So part of the prostate causing trouble, number one, is aging. So there's not really a lot that we can do about that one, right? As we get older, our prostate as men gets larger and can start to cause trouble. As far as prostate cancer goes, prevention, a lot of it is kind of related to the cards you're dealt, believe it or not. So there's not a ton that you can do. There is some limited data and some studies that talk about exactly what you would suspect for when you're trying to improve your health overall. So a healthy diet and lifestyle, exercising throughout the week. There is a limited data study that talks about kind of a lower fat diet, or that Mediterranean diet that has shown some potential to having a lower or slightly decreased risk for prostate cancer. The biggest ones I always recommend are exactly what you would do to just maintain a healthy lifestyle in the first place, which is eating a well-balanced diet, fruits and vegetables. And then the only other one that I add to the mix is that potentially that lower fat diet that can potentially lower your risk for prostate cancer.
So I love how a lot of things, even your prostate, can be helped.
It's all intertwined for sure.
Diet and exercise. I didn't pay him to say this. I didn't tell him to say this, but it's even the tiny, teeny prostate, which is a small sized organ, can potentially be affected by your diet and lifestyle. You had mentioned smoking earlier as a risk factor. So of course, not smoking would be one thing to do to protect your prostate. Now, there are some things you can control and there are things you cannot control. So obviously aging, you get older, right. It's part of it, right? Yeah. So those change, but there are other things you could do to minimize the risk of you having prostate issues. Mm-hmm. Awesome. Now let's talk supplements. I also like to reemphasize at this point that, of course, these discussions you need to have one-on-one. It should be individualized with your own doctor, your primary care doctor, your urologist. So these are suggestions. You should not be taken to heart. These are suggestions. So what's your take on supplements? I have this discussion a lot with my patients.
Yeah, absolutely. And I have a lot of patients when they come in too, that they say, hey, doc, I've been trying this. What are your thoughts, right? Mm-hmm. One of the big ones that comes up a lot with prostate health is one called saw palmetto. A saw palmetto is an herbal supplement. It's based from a certain type of plant, and it was used historically a long time ago. And people still can get it if you go to the pharmacy. They have it available. The thing that I always tell my patients is there's been multiple studies that kind of look at saw palmetto specifically compared to just a placebo, and just about every single one shows, when you look at the ability for your strength of your stream, the improvement of symptoms, all these other options that we look at when we're looking at drugs to help the prostate, they all didn't perform any better than placebo. So it's one of the, is it going to hurt you? Probably not at all. But can I say that it's probably helping that much? Unlikely, as far as saw palmetto goes. That being said, we have lots of other medicines that we use pretty routinely that are prescriptions that absolutely we have ways to say that, yeah, this is going to help you for sure. So it's one of those that if my guy's been on it for a while, or they're taking it and they're happy being on it, I'm not going to tell you to stop taking it, but I don't have really any good information that says that medicine specifically is going to help you. There is another supplement out there called, I don't know if you've heard of Super Beta Prostate. It's one that I see kind of routinely. It has a specific, it's got actually a bunch of stuff in it, believe it or not, because you imagine with supplements, they're all not fully FDA regulated, but the main portion in it that is what's called a beta solosterol. And what that does is has been shown to help with some of those urinary symptoms. So it's not necessarily helping shrink the prostate or anything like that, but it has shown some small effect over placebo. So it's one where if I have patients that are really against any kind of prescription, that is an option. But it's not FDA approved. So there's other stuff that's in it compared to what you would expect all the time. So again, should be a conversation with your urologist or your primary doctor for sure.
Okay. So discuss with your doctor use of supplements, use of all supplements. So we informed this information about the supplements, the pluses, the minuses, and the validity of the supplements. I've had patients use them and who swear they feel better as long as the lab results look good and there's no doesn't show any damage to liver or other parts of your body. Typically, it's something to watch as well. So this is good. A lot to learn. A lot we have learned in the conversation today about the prostate. So prostate is a male organ. We learned that it's primarily a sexual organ. We learned ways to protect it, how it is checked on, and the importance of doing your prostate checks, and when you should talk to your doctor about concerns that may be prostate related. So I'm happy we had this conversation. I'm sure there'll be questions.
Absolutely.
Private. Later. We would do part 2 as requested by our patients, and with specific questions. But for those who are watching, who are like, where's this doc? I see he's in Mansfield too. Where can our viewers, where can they find you?
Absolutely. So as far as our physical address, we're at 2302 Lone Star Road in Suite 160. It's actually the professional building just right outside of the newer Texas Health Mansfield Hospital down here on Route 287. That's where my physical office is located here. As far as ways to get in touch with us, our website for the practice is texascenterforurology.com. I'm also personally on Facebook, Instagram, Twitter, all of the above, and that's Dr. James Kelley Urology. That's Kelley with an EY if you're ever trying to find it and it's not popping up there. So those are the easiest ways to get in touch. And then our phone number as well is 817-769-3370, and I'm sure we can get a link, or I'll drop a comment in there with all the contact information for anybody that's
awesome. That would be awesome. And I like the Twitter.
I got them all on there for sure.
Awesome. Well, it was nice having you. Thank you so much for coming. I appreciate and answer the questions, and I'm sure our viewers appreciate that as well. So we're going to wrap up now. And for those who are looking for a thorough, caring, and passionate family physician here in the Mansfield area, I am she. Thank you so much, Dr. Kelley.
No problem.
Thank
you again. We'll talk.
Lit. Roll up to the party, roll up to the party, roll up to the party, roll up to the